Assalamu alaikum warahmatullahi wabarakatuh.
Wa alaikum salam warahmatullahi wabarakatuh.
Inshallah, today we'll be having another discussion on comprehensive healing from the prophetic medicine, and it will be anchored by our one and only immediate past president, Dr. Salaudeen Mohammed. And in order to kickstart, as usual, we'll start with our opening prayer by calling our Sheikh Daoud Adelakum to give us the opening prayer.
أعوذ بالله السميع العليم من الشيطان الرجيم.
We will have a short profile of the presenter, our lecturer today, Dr. Mohammed Bashir Salaudeen, and the profile will be given by our publicity secretary, Sister Minat Adepoju. The profile of the lecturer, please.
Assalamu alaikum warahmatullahi wabarakatuh. This is the profile of our lecturer delivering the health talk for today, Salaudeen Mohammed Bashir. Our Salaudeen Mohammed Bashir is a certified therapist and a graduate of the International Institute of Islamic Therapy in Nigeria. He's a member of the Certified Islamic Medicine Therapists of Nigeria and an active member of the Tib Nabawi Islamic Medicine Practitioners. He has successfully developed various prophetic herbal remedies addressing a range of health challenges and has utilized hijama, cupping, to treat numerous individuals, both healthy and healed, all with blessings and to the glory of Allah. So we can rest assured that while getting this lecture from a certified practitioner, and inshallah, whatever we learn today will be beneficial to our knowledge. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu wa rahmatullahi wa barakatuh. On that note, I would respectfully invite our lecturer for today, Dr. Mohammed Bashir Salaudeen, to take the podium and give us this well-anticipated lecture. Assalamu alaikum wa rahmatullahi wa barakatuh.
Bismillah ar-Rahman ar-Rahim wa salatu wa salam ala Rasulullah. اللهم أنت ربي لا إله إلا أنتني وأنا عبدك ولا أنا عبد وادك ما استطعت أعوذ بك من شر ما صنعت وأبوء لك بنعمتك علي وأبوء بذنبي فاغفر لي وإنه لا يغفر الذنوب إلا أنت. والصلاة والسلام على رسول الكريم. I'll appreciate that we mute our mic so that we don't get disruption along. I would like to urge you to do that so that we don't get disruption of this system along the line, inshallah. If you can mute our mic, I'll appreciate it so that we can go slowly and we can appreciate and understand ourselves. Thank you very much. And Jazakallah khair. Yeah. Bismillah ar-Rahman ar-Rahim. We want to look at the topic again is about the healing practice of the Prophet sallallahu alaihi wasallam and how it affects human health and challenges that we have. Let's go. So first, we want to define health as defined by the World Health Organization today. They define health as a state of complete physical, mental, and social well-being, and not only the absence of illness and infirmity, which means that being healthy does not mean that only that you are not ill or you have some challenges or discomfort, but health is beyond that. So this is what Islamic health, or rather the prophetic health details have challenged and have explained even long before the modern medicine, because we are aware that Islamic, the prophetic healing practice has been around before modern medicine, which means people have been taking care of themselves and have been taking care of everything around them before now. So in that vein, we love to introduce the prophetic medicine. What is prophetic medicine? It is a holistic healing system of the soul and physical body, as prescribed by the Holy Prophet Sallallahu Alaihi Wasallam. About soul first, before the body. So which means we must clean our soul. What is our soul? Which is an abstract. Something that connects us with our Creator. Something that we work with to connect with our Creator. Something that is abstract that you cannot feel, you cannot touch, but you can imagine and take care of it and give it food for healing, for survival, and for existence. And that is what our Imam have started with today, doing Azkar. Our Sheikh, the political Sheikh mentioned it earlier, standing up in the night to do Qiyam al-Layl. So we nourish our soul to get health, and the physical body will nourish it. But unfortunately, most of the time we nourish our physical body without our soul. You can nourish your physical body sometimes and your soul will be sick. So tip number, we've used the human body as a combination of 5 bodies. Tip number is the medicine of the Rasul that are compiled by people that are close to the Prophet during the time, as we found in the Sunnah of the Rasul. People after that, and the Muslim up today continue to open up the Tabi'in and Tabi'in were able to put a lot together, but after them, the present-day Muslim are beginning to do a research, beginning to expand that and how to get more healing from the same herbs and all the other processes that's prescribed by the Rasul. Let's go to the next slide. So we have 5 bodies as identified by God. One of the first is the physical body. The physical body that looks at all a system in our body, from respiratory system to the digestive system to urinary system, the reproductive system, and all the lymphatic system of our body is what the prophetic medicine take care of. Let's go to the next one. So after the physical body, we now have the biochemical body. What is biochemical body? My brothers in medical sciences and pharmacy will appreciate the fact that within our environment, we have a lot of chemical within us that affect the biology of our body, the air pollutions, water pollution, soil contamination, and how this thing goes into different parts of our system, the respiratory illness that this thing might cause, the cardiovascular illness that this may cause, some things that have to do with cancer, gastrointestinal activities that this thing may disrupt, that give us a lot of ailments because of the layer of our body. Like the air pollution, for instance, can affect the carbon dioxide we inhale, particular matters zone, and volatile organic compounds that we inhale and affects our body as physical. So this biochemical body affects our body in terms of effect of pollution on our body. Let's go to the next one, which is our intellectual body. This is a combination of what happens to events and or situations that happens around us, will literally lead to an emotion and a behavior that we react to in terms of emotional touch. Then what we think about and reflection of our attitude and the belief that we believe about those things that are happening to us. So our general intellectual body is a whole holistic that is also taken care of by the prophetic health medicine that has been provided for us by the Rasul. Let's go. Then we now have our emotional body. How do we our stimulus to things within our environment, within ourselves? How we pay attention to those things. Then when things stimulate and we pay attention to them, then we now interpret them in a certain way. Then our body will react to it. And this is also parts of different body, different from the physical body. So our emotion is determined by a lot of activities. Our environment, our thoughts, our sensations drive those objects. And we now begin to see the events that happen afterward. Let's go. Then the spiritual body, which is the myths. Our spiritual body is all we looked at, has to do with our soul. How are we growing? How is our environment being taken care of in terms of spirituality? Are we lifting our hearts when we observe those things? That do we follow the instruction of our Creator? We follow the instruction of our Creator. How much of this did we create? Do we follow? Do we follow His institute? Do we observe it? Do we respect it? Do we connect our God, ourselves with the Creator, such that our spiritual body will be healed, our soul will be consoled, and our body will be alive? Let's go. So if we look at this, we now look at the branches of prophetic medicine as encapsulated by Ashab al-Nabawi, as the prophetic herbs. So we have herbs. We have Tib Nabawi that we talk about. Tib Nabawi is about the the health completely of the prophetic herb, of prophetic medicine. So Tib Naba is about prophetic medicine, but individually we now begin to have it in different shape. That's the prophetic herbs, which is different from the prophetic medicine. What are the things that prophets use, sallallahu alaihi wasallam, to take care of certain things? These are things that are either in the Quran that are mentioned by Allah subhanahu wa ta'ala in different verses of the Quran that talks about different kind of herbs that we can use to get healing. At the same time, the Rasul now used some others, sallallahu alaihi wasallam, and his disciples, tabi'in, the tabi'in, the 3 generations after Rasul were able to use some of this because those are the reliable and most trusted generations in terms of reliability. And they use some of them are put together in Tib Nabawi. So in breaking down the prophetic medicine, we have the spiritual healing. The spiritual healing has to do with how to heal ourselves spiritually if we are attacked by the spirits. Then we talk about the coping therapy, which is the hijama, which was recommended by the angels for the Rasul to be doing regularly. Then we have the prophetic herbs. We now talk about herbs, different kind of leaves, roots of trees, seeds of various types, even including different parts of animals that are halal for use for healing our body and our soul. So what we are talking about here is prophetic medicine, which is Tib Nabawi, is broken down into spiritual healing, taking care of various things that comes with spirit. All things affect our spirit, all things affect our brain, our hearts, and make it negative, and begin to give us some concern in terms of health and how to take care of that. Then we talk about coping. Coping therapy is otherwise called hijama. That's blood letting out of our body to remove the toxic in our body. Then the prophetic herbs, which are the herbs. Even in modern medicine, they use herbs to produce a lot of medicine that we take. We only do it differently. Let's go. So what is prophetic herbs? Let's start with the herbs first. So prophetic herbs is defined as the herbs, the roots of a tree, the stem of a tree, the bark, the plants or seed of an organ of a lawful animal or substances derived from animal. Those are things that Rasulullah sallallahu alaihi wasallam used most of the time to do some healing. This also includes water provided by Allah subhanahu wa ta'ala that is mentioned in the Quran or either in person or as well as those categorically prescribed by the Holy Prophet sallallahu alaihi wasallam in authentic tradition, or those used by his companion or the early Muslim in the first 3 generations. That's the Sahabas of the Rasul, the Tabi'in and Tabi'un. So this is telling us that by prophetic herbs we mean the roots of different kind of trees that are halal, the same of those 3, the bark, the plants, or the seed of organs of lawful animals that are substances that are derived from different animals. Like the camel has a lot of healing powers and the rest. So some of the parts of the camel are also used. So it also includes even water like Zamzam and even rainwater that are mentioned are used by the Sahabas, the Tabi and Tabi'un for kind of healing of Muslims. So that is what prophetic herbs refers to. Let's go. So what are those things that the constituents of prophetic herbs? Like we mentioned earlier, we talk about the roots of some tree, like kists. Kists is a kind of a herb. There's Kistel Hind and Kistel Bahar. Kistel Hind is a little bit bitter, Kistel Bahar is light, and it can be used to deal with a lot of spiritual issues and to deal with some medical issues also, as prescribed by the Sharia, as used even by the Rasul sallallahu alaihi wasallam mentioned. So, and organs of lawful animal like the camel, the heart of the camel is also used. So these are mentioned by Allah categorically in the passing and e.g. Zamzam water like teen, and like in Surah to teen, like we see this Quran talk about what teen was zaytun. So which means talk about teen, talk about zaytun and so many others as mentioned in the Quran. Then we talk about the leaves, e.g. Sina, used by the Sahabas and Tabi'un, e.g. Atif Jami'i. Atif Jami'i is a kind of a seed that can grow from a tree that the demons do not like. So when you have it around you, they don't like it. And the Sena can also be used for so many things for Sena. So, and it has a lot of functions. They use it for cooking, it's for like spices, use it for like, it can be used in growing, to grow hair, to make hair grow for women and A lot of other things can be used for. And they actually use it to even wash the dead in some part of the world, to cleanse the body of the dead. So substances derived from the lawful animal, like musk. Musk, is gotten from some part of animal, and they make it into perfume. Some part of it are also used for some other things, depending on the individual. I will suggest to remove our video and remove our audio also, causing some distraction for me, if you don't mind. So water, e.g. Zamzam, we have mentioned also, is prescribed by the Rasul for use. And just like example of all the herbs, like the abat soda also, they are very, very common. Some of these herbs are so many, but then because of the environment we have served, because our research in our institute have found out that there's some of these herbs that have been abused because we don't know how to handle them. And we begin to abuse them to the extent that it doesn't even give results anymore. So let's go. So in looking at the herbs, I have to choose Habatus Sauda, which is a black seed, because it's the mostly abused prophetic herbs. This is arguably the most popular of the prophetic herbs. It is globally and widely patronized. Almost every home has Habatus Sauda. This is probably as a result of the prophetic prescription that it cures all ailment except death. Khalid bin Sa'ad narrated that he once went out with Ghalib bin Abjar, and on the way he fell ill. We then returned to Medina. Ibn Abul Atib visited him and said to us, "Why can't you use this black seed? Take 5 or 7 seeds and crush them and then drop them into his nose with a few drops of oil here and there, because Aisha once told me that the messenger of Allah said, the black seed is a healing for all ailments except a psalm." I then asked, "What is psalm?" He said, "Death." This is in Bukhari. This hadith number 5687 in Bukhari. So the meaning of this is that Abu Jabbar interpreted this hadith to mean that every disease is treatable with this herb. Let's go. So Habatus Sauda is very popular. It's in seed, it's in powder, and it's in oil. So the black seed oil on some ailments can cure. So let's look at some of these things that you can take care of with black seed oil. I don't recommend that people individually use it because there's a lot of condition attached to it. That's why I didn't give the details of how it's going to be used, because we abuse it so much. And there are some people that are trained specifically for different brands and different make for you to be sure that you are using the correct one, because there's a lot of fake also, because they know that people use it. So there are a lot of fake. It cures ailment, both physiological ailment and spiritual ailment. Habatus Sauda is also called the Habatus Baraka, the seed of blessing. In reference to Baraka, the prophet's nurse, Ayman, who was found of always using it for treatment of different ailments. And thus, the Holy Prophet named the herbs after her. And coincidentally, it is a blessed herb. So one of the things it can do is it treats bronchitis, like asthma, neurodermatitis, as well as poor digestion. But it depends on specific use. You don't just continue to use and consume it and guess it's going to treat this. So there's a way to use it. Use the management of diabetes mellitus. It can cure and take care of diabetes if used appropriately. That's potency against respiratory ailment. Different respiratory ailment can be taken care of by Habatus Sauda. It also acts as an antihistamine, which means if somebody have allergy in different area, Abba can be used. A strong antioxidant that helps clean the body of toxin, so which means it's antioxidant that can cleanse all those antibodies that the body does not want on its own, and that can remove toxin from the body. The seed extracts, if it is cold pressed, has also been found to stimulate bone marrow and immune cells. If taken with milk, it can cure jaundice in small children. Beyond this, it can even take care of all this mouth ulcer. If you just put something in it, just small, and rub the mouth of a child, it takes care of the mouth ulcer. If there's a chronic mouth ulcer today, by the time you use it 2-3 days, the mouth ulcer is gone. When the oil is administered through the nostril, it helps against facial paralysis and cold condition accompanied by excessive sneezing. It also is also effective for treatment of ear pain if you begin to have pain in the ear. The crushed seed should be taken with honey and warm water to treat and destroy kidney stone. Some of these things have been used before and they've been practiced For me personally, it has worked for me in some ailment that they told me in the hospital I cannot be treated. And it's been confirmed, not just me, from other people. There's an ailment that's popular that's called glaucoma. The reason why I've been able to treat glaucoma with a butter soda, and that's worked for me. That's worked for someone also in my family. But then you have to get the right original quality for you to be able to use it effectively to deliver. Because there's a lot of fake, like I say, because it's been in high demand, so people fake it, they dilute it. What they do is to buy original and dilute it and make it so the potency get to wade away completely after a while. So I had to choose this because the intention is not to look for a particular herb and begin to discuss it, because this is talking about prophetic herbs specifically. And can we mute your mic, please? Kamaluddin Bello, can you mute your mic, please? So let's go on, please. So we have looked at, in trying to look at prophetic medicine, we'll talk about herbs, then we'll talk about ijama, then going to look at spiritual healing. Let's talk about ijama. What is ijama? Ijama is a sunnah as well as medical treatment. The word ijama is derived from the word al-hajj, which carries the meaning to suck, to absorb, or to extract. Describe the medical treatment whereby dirty blood is extracted from the body by a suction cup attached to a lightly incised skin surface. It was common practice in traditional Arab medical practice, and is always a sunnah ascribed by the Prophet and promoted by the beloved Prophet sallallahu alaihi wasallam. If you see on the picture on the right, that is the cup placed on somebody's body. So this cup is placed in the photograph, and that suction on top is pressed so that the skin goes into the cup. So all the toxins in the body, that part of the body, will gather in that area. I'm not aware of any medical practice that removes toxin blood from the body apart from ijama, like this, through the blood, dead blood cells, bad blood cells, the dead red blood cells, and the rest. All the toxins that gather, they come together as you apply negative pressure on the skin, and this comes out. These are identified specific area to doing it. So cupping is also an ancient Chinese method of releasing local congestion. It has been practiced for thousands of years in almost every part of the world for treatment of disease and pain. Let's go. Why is it very popular? Why is it important that we should take it as a Muslim? Because it's the Messenger sallallahu alaihi wasallam said, "I did not pass by any group of angels on the night of Israel." That's the Prophet's night journey when he was taken from Mecca to Jerusalem and back in the course of a single night. But all of them said to me, "You should use cupping, O Muhammad." This is classified Sahih from Sheikh Albani, and Silsilah Sahih is number 2263 on the Hadith. So that's the cup that shows, and there are different parts of the body that you apply it, because this body and the location where for different ailment has to be studied, has to be known for you to be able to apply it and use it effectively. Let's go. According to Rasul, apart from saying that it's recommended by the angel, say ijama is the best remedy according to Rasulullah. So, as Ibn Malik reported that the Messenger of Allah sallallahu alaihi wasallam said, "Indeed, the best remedy you have is cupping ijama." This is Sahih Bukhari 5371. In another hadith, Abu Hurairah reported that the Messenger of Allah sallallahu alaihi wasallam said, "If there was something excellent to be used as a remedy, it is the cupping, that's hijama." This one is in Sunnah Ibn Majah and in Sunnah Abu Dawud also to confirm this. So the photograph on your left shows the different part of the body that has been studied by scientists in recent times and have been developed to know that these things can actually be treated, can be used for effective healing practice, bi-iznillah. Let's go. Also, the Rasul said that hijama is a cure. According to an hadith narrated by Jabir may Allah be pleased with him, the Prophet sallallahu alaihi wasallam said, if there's any good in your medical treatment, it is the knife of the cooper, drinking honey, or cauterization with fire, as appropriate to the cause of the illness. But I will not like to be cauterized in Sahih Bukhari 5357. So Rasul sallallahu alaihi wasallam specifically mentioned that this hijama is a cure, is a healing, and it's holistic healing. So if there's any good in medical practice that we practice, we must put hijama in it. That it is the knife of the cooper. That's the big. Then drinking honey or cauterization by fire. But he doesn't like cauterization because it involves fire. So it's not done by cauterization. But he says it's healthy, but he doesn't like it, which means since the Prophet doesn't like anything, we shouldn't go there. But in drinking honey and knife, maybe some other time into the future, inshallah, if we have time, we may begin to look at some of these herbs individually, if time permits, and begin to break them down into more details of what are they used for and how they are used to treat what ailment. But then we take it from the ailment angle. This ailment and the cure for them and how it can benefit us, inshallah. Like I said earlier on, if you look at different parts of the body, it has some healing practice. So some conditions that can be treated by through cupping, that's hijama. It can treat migraine, rheumatoid arthritis, stiff or swollen joint, especially in the neck and the back, stomach ulcer and problem associated with diabetics, high blood pressure, psychological disorder, and some cases of paralysis. Black magic, back pain, joint pain, gout, constipation, digestive problem, and loss of appetite. Can cure insomnia, problem associated with menstruation, headache, strengthen one's intelligence and memory, and poison. This actually been used for so many, even for infertility. It's been done for severally and it has worked. But then we should remember, put at the back of our mind that this is a therapy, and a therapy takes a while, which means you're not going to do it once and get results in some of the ailments. For migraine, you do it immediately, be easily lie, you get results. But some may take, you may do have to do it 4 times for you to be able to get effective result. But business line, it works. It has worked for some people. And we have seen results. Let's go. So we have looked at herbs, we have looked at hijama. Let's go. Let's look at spiritual healing. But then let's start with spiritual attack. What is spiritual attack? It's the diabolical manipulation of reality to give a contrary result to reality, which means something that is not real, you make it real in the face of people. That's when somebody that's hitherto is healthy, suddenly find that it's not healthy, which means the health may not be what is designed for that person at that time, but then it could be, unfortunately, somebody that's been prepared by something else. Let's go to the details. So in spiritual healing, the roots, sources of evil are traceable to 6. Most of the evil that happen to us that affect our health are usually traceable to 6 major things. Is the jinn or the jinn crafts or demonic possession. This is very rampant. This is very common. The jinn has been there for life. Before humans are created, the jinns were created, and they were there, and they are very vicious. So they attack people for different reasons without any cause, because they dislike human beings. One of the reasons why jinn will not like human beings is because the most ugly human being will be a beauty queen in the palace of the jinn, because they're usually very ugly. So, and they don't like human beings. I'm sure you know, we all know the story of Adam, alayhi salam. They never like human beings from creation. So, and up to tomorrow, they will not like human beings. So, one of the root sources of evil that's traceable to 6. Okay, so yeah, they can cause a lot of things to us as humans. The jinn and their jinn craft or demonic possession, as we call it. Then sihr. Sihr is a spell, sorcery, which may be witchcraft or magic. So that's sihr, which means, and a lot of the time it's actually jinn that were used for sihr. They use them to deliver that to whoever they want to deliver. So they are the one that have been propelled. Unfortunately, we know that human beings are usually more powerful than jinn, but we don't know because Three things that separate us so that we are, because we don't see them, it's enough fear that we begin to get scared of them. We are more powerful than them because that is why human beings sorcerers can use them and send them on errand. We have had stories of jinns that were sent on errands severally to the extent that they die because of being used as errand by human beings, which means human beings are ordinary, more powerful. The only difference is that they are faster and we can't see them. So we look at eye, evil eye. Evil eye is another that we usually inflict on ourselves or inflict on human being, knowingly or unknowingly. An evil eye can be inflicted on fellow human being. Even someone can inflict himself or herself with an evil eye without knowing. Maybe into the future, if we have time, we can look at evil eye in details. Because the Rasul talk about it, and we have several examples of how he was able to take care of some evil eye that afflicted to some of the Sahabas during this time. Then Allah causes, which Yoruba call Ekpe. Ekpe is also propelled a lot of the time by jinn. It can happen without jinn, but a lot of time it's being used. Jinns are being used because we have jinns that are errand jinns that are sent on errands, and the individual quorum of human being can be sent on errand also, only by body, and they can be used to cause human being. And causes are various type of causes, so many of them. We actually have different type of causes, and we have like 4 different major type of causes, and we have like 8 or 7 ways of the means of causing people. You can look at them into the future and how it can be devastating for human being. Yeah, we have the soul qadar, that's the evil decree, something that has been decreed by Allah that is going to happen to somebody. It has been decreed. There's nothing to remember the story of Nabi Yusuf alayhi salatu wasalam. They have to go to jail, that his brother threw him to the well. Those are evil things that happen to somebody, but it's been decreed by Allah that it's going to happen. In his own case, he came out at the end of the day to become a king. Things will happen to some people that are evil. There's nothing you can do about that. Then we have the physiological ailments. Physiological ailments of human beings. Something that somebody has fever, and because he's been he met on his way, maybe he goes to the club or he went to where he's not supposed to go. Then he got. Can we mute our mic, please? Can you mute your mic, please? It's distracting me. So, Adekoya 9 months. Can you mute your mic, please? Look at our evil decree. We have talked about it. Then the physiological ailments. We have physiological ailments that can be turned spiritual. So that's when we call psycho-spiritual. It has become, it started as an ailment, and suddenly spiritual takes over that. Let's go. So is this spiritual ailment, because we have preventive measures against jinn possession, affliction, seer, and evil eye. We have preventive discussion, and Allah has blessed us so much as a Muslim that we can take care of this thing without us knowing that we're even taking care of it. Absolute encapsulation of the Tawheed in words and deed, as well as total repudiation of shirk, its various form and its associates. If we leave shirk completely and we follow Tawheed according to the Sunnah of the Rasul, and as prescribed and recommended that we should do by Allah in the Quran, we have complete cover. And we have complete reliance on Allah, not looking for Buka, not looking for somebody somewhere who will use something for us. What they are using for us can even inflict more injury on us. Strict adherence to the authentic Sunnah. Do this, don't do this. You live in your house, you perform. If you're going out of house, you say the dua for going out of your house. If you are going to your vehicle or you're entering vehicle, you have to enter vehicle. If you want to eat, you have to eat. If you want to sleep, you have to sleep. You want to wear your clothes, you have to enter. You want to enter your toilet, you have to enter the toilet. Do all these things. None of these things will have effect on you. Adoption of the life of devotion, of worship. Congregational salats. Do tahajjud. Do tatawah in terms of fasting. If you do this on regular basis, you are encapsulated. Living a pure life, physical cleanliness, be clean, Don't wear one clothes 4 or 5 times. Cleanse yourself. Have your bath regularly. Spiritual cleanliness through abstinence from sin, such as telling lies. If you tell lies, you don't even have good dreams. One of the ways we use in checking, if you want to diagnose this way of checking somebody that has spiritual lack, is to tell if somebody have a dream. And if you dream, you're not going to have any good dream. If you tell lies, you're not going to have any good dream. Stealing, envy, zina, pornography, masturbation, listening to music, consumption of alcohol, other intoxicants, etc., will expose you to so much danger. And spirits, jinns, demons, curses, iron will affect you very easily because you've given them opportunity to. And keep your secret to yourself. Don't be too lousy. Social media, we are here. We have achieved this. We have delivered this. And iron can enter. Even through your phone, through your whatever, you can get it done. I guess there's a last point there that is not shown on this slide. But in any case, these are some of the things you need to do. The use of this askar, morning and evening askar. Sheikh started with askar as we start this. We are supposed to do askar every morning, do askar every evening. We thank our scholars, our imams in AMP. There's a prayer book. If you go to that prayer book, there's a portion of it that talks about protection. Within 10 minutes, if you are very fast, if you are used to, if you start initially, it can take you 18 to 20 minutes, but if you are very fast, within 10 minutes, you finish that askar. And you cannot begin to do askar even when you are in the car, or when you are the vehicle going to work, when you are going to your shop, when you are going to school. Be doing it on the way. So follow up achievement with mashallah anytime you achieve anything good. Thank God for it. It's not by your power. Don't be too loud. Don't be too lousy. Those are some of the things we need to take care of because you don't know who hates you or who doesn't like you. In your place of work, in your markets, in your office, even in your environment. The fact that you are alive, you are healthy, you are fine. What about your children? So it's important for us to do this thing and follow all these rules and many more to be close to Allah, for us to be able to wade away sihr, evil eye, jinn possession, and being affliction. But when you have, if somebody is already afflicted, you can get help. And those help will come from professionals, people that knows how to handle it and deal with it. Because there's a terms and conditions and ways of doing this thing, which is not everybody that knows and how to handle it. Let's go. So everyday care. Here, I'm done with my presentation proper, but I want to share something with the group. I talked about soda a while ago. That's the black seed oil. And I talk about being good for glaucoma. But then there's a lot of brands. If you have pen and paper, there are some brands that have been confirmed that are good brands of about soda because the fake are more than the good one. Those ones that are good are the ones that are produced by cold press. But then in the bottle, you not see them write cold press there. There's one brand that is popular in Nigeria. You can find it. I found it. I bought some in Agege last week or 2 weeks ago. There's one they call Al-Mu'jiza. Al-Mu'jiza is otherwise called miracle. If you make noise, you don't understand. You don't hear what I'm saying because there's noise that comes from the background. So it's about 125 ml of Abat soda. And there's one called Abat soda al-Bashir. But in Nigeria, there's one they call Kalamur Rasul. Kalamur Rasul is popular in the north. I found it in Kano. Imani is in Lagos, about 250 ml. But then I found a different kind of Imani. There's Imani now that is sealed with a seal to confirm originality on it. Then there's Al-Baktur. Al-Baktur is not locally available, but you can find Imani and Al-Mujiza in Lagos. I've seen it in Lagos before. So if you can find those one, you can use that. But then in every day, when you look at medical bill and we look at the challenges of our time today, you find out that there are certain things ordinary within our environment that we can use very quickly to take care of certain things. The modern medical practice will say that the challenge we have with some of these things is dosage. With us in Prophetic Medicine Palace, we also use the dosage because most of the people that were in class with us that are fellow student or fellow faculty and the rest are actually university medical professors and the rest. So they know importance and they've carried out a lot of research on this thing before it's done. If it is important to have purple leaf around you, guava leaf or mango tree, especially if you have your home, you can even do it purple leaf. It's very easy because it's very, very useful. I'm sharing this so that when it comes to treatment of things like malaria, some few ulcer, some unusual high cholesterol, or even what's the senior brother of malaria? Typhoid. So some of these things can take care of it. And how do you do it? It's very simple. But if you listen, you find out that you get the dosage. It's just one leaf of purple, just one leaf. One purple leaf usually have like between 8 to 9 or 10 fingers. And if you can plug it from the top, it's better. Those ones on top are the best of it. So if you have just one and put it in just 1 liter of water and heat it for 20 minutes, wash it very well because it must have been dirty because of the environment. I'm not saying you should squeeze it, just wash the surface with clean water, under running water, and put it in a pot and cook it for 20 minutes. Then divide the water into 3. That's all. So you have seen the dosage, you have seen the cooking, what you need to do, and you can put it in your flask and take it to wherever. If your case of malaria is not chronic, or your ulcer is not chronic, your diabetics is not chronic, just at the stage, but you should confirm all this before you start taking it for everything. So once you do that, it takes care of your malaria, takes care of your typhoid, it takes care of your ulcer, and even some bone related something. A lot of diabetics cases has been dealt with this. If you take this over time, I found out that when you take it over time, you become immune, and even when mosquito hits you, you can begin to eat mosquito instead of mosquito biting you. So these are for purple leaf. The same thing with guava. You can do a lot of things with guava leaves also. The same thing with mango leaf. If you look at the 3 of them, the mango, the guava, and the purple leaf is bigger. In an average purple leaf, you can find like 20 guava leaves there or more than. The mango leaf is a little bit bigger than guava leaf. So if you can blend the 3 of them, dry them inside your house, I'll give you the volume. 1 mango, 1 guava tree, 1 guava leaf, 1 purple leaf rather, to like 30 guava leaves and 20 mango leaves. If you blend them together, dry them inside, clean them, dry them inside your house, now blend them together, put them in a container, and just take 1 spoon every morning. It will have come like tea. If you are good in making tea, like me, put it in the tea bag and seal it. Otherwise, just put it in warm water and take it like your tea every day. So you use your food like your medicine on regular basis, and you'll be fine. But everything that I've said, you don't use it all the time. When you are fine, you leave it. It's not something that you continue for life. That's what I want to hear. So if you have any question, I guess I'll stop here, business line. Thank you very much. Assalamu alaikum warahmatullahi wabarakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Jazakumullah khairan to our lecturer, our facilitator for today, for that very informative and educative session.
Lecturer.
So we will, inshallah, be proceeding with questions. But before we do that, I'd like to urge every one of us to please keep our mic muted. If you have questions, raise your hands. I would take turn to call people who have their hands raised up one after the other. So please, if you have questions, raise up your hands, and inshallah, I'll call on your names, and guest lecturer would address your questions or contributions. Let's keep our mics muted until we're called upon. Thank you very much. But Imam Saadullah Amzat, you have the virtual podium, sir.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
I have 2 questions. One is a question, one is a request. The one that is a question is to say, how can we approach the issue of hijama? Some of us are interested in doing the hijama, but we're so afraid of quacks. I want to ask my brother if we can ask to do ijama with him, and how soon can we do that? That's one. Two, if anyone wants to learn this alternative medicine, can he provide the teaching, and at what conditions? Those are the two I want him to please address. Thank you. Jazakumullah khair.
Jazakumullah khairan, sir. Facilitator, sir, do you want to provide the response to that now, or we should take all questions?
Can we take all questions?
All right. I'm sure you have that noted. So I'll be moving on to the next person, inshallah. Sister Balkis Tonya Adekoya, you have the virtual program.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Our speaker, you are well appreciated. I had two questions, but one of the questions has been asked concerning how we can have the opportunity to go through ijama. Yeah. Then the second one is when you were rounding up, you were trying to talk about how to use abatu sauda to cure glaucoma, but you did not remember to say it. I will appreciate if you can touch that aspect. Jazakumullahu khairan.
Thank you very much for the question. Right, moving on to the next person. I have Brother Goke Adeyemi. Brother Goke Adeyemi, you have the virtual podium if you can hear me. Okay, while with Brother Goke Adeyemi, I have a question on the chat box here. And the question says that, is aloe vera one of prophetic medicines used for curing malaria fever? That's from Sister Salami Waliyat. Right. So that's another question that we have. Next is Brother Omoni Adeni. You have the virtual podium. Please unmute your mic and ask your question.
Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa
Wa alaikum salam.
Wa rahmatullahi wa barakatuh.
Now, when the speaker was talking at a point, he said, "What is the brother of malaria?" And that's a typhoid. Typhoid is not brother and sister of malaria. It is only in Nigeria that we assume that malaria and typhoid goes together. Typhoid is a bacterial infection, while malaria is not. That's that, which all of us had fallen into this same pit of believing that malaria, typhoid must go together. Please, they don't. It's just unfortunately that majority of the lab we have here are not good in detecting. They don't have good reagents. Well, that is that for NAFDAC to go and do is a proper work for control. That's that. The second one I want to ask is problem of dosing, that we believe the other herbal thing. Though today they will tell you take one spoonful or take a gas cup in the morning and evening. That is not just the dose. Dosage in drug preparation starts from the preparation itself. So the Oyibo one will tell you put 1 gram of glucose with 1 gram of this with 5 grams. So the dosaging starts from the preparation. So when you say take leaf of or the pawpaw, let me use the pawpaw, which one of the example you used. The pawpaw size is always different in weight. Does anybody take the weight before that? When you say take seed of pawpaw, it's need to be counted or to be weighed when you aggregate the seed. So the dosaging how does the prophetic medicine take care of that? That's the question.
All right. Thank you very much, Brother Adeni. The question is, how does prophetic medicine take care of dosage in terms of drug administration? Right. So I'll be moving on to our next question so that we can take all, and our facilitator can take time to respond to them. One question I have on the chat box is, can you please talk on the uses of cedar leaves or powder in treating some illness spiritually and physically? That's from Sister Roimot Mutmayo. Then our next question will be from Brother Abdurazak. All right, Brother Abdurazak has dropped his answer. I'm guessing his question has been answered.
Assalamu alaikum.
Wa alaikum salam wa rahmatullah. Wa alaikum salam.
My question is there a comprehensive curative therapy yet for cancer treatment? A comprehensive curative therapy for cancer treatment. That is my question. Yes, sir.
Okay. Thank you very much for the question. I can see you dropped that on the chat box. All right. Is there a comprehensive curative therapy for cancer treatment? Right. Thank you very much, our brother. I guess that's it for now. Thank you very much, everyone, for the questions. I'll be passing the mic back to our facilitator to provide responses to the question. Brother Mohammed Salaudeen. Back to you, sir.
Bismillahirrahmanirrahim. Can you hear me?
Loud and clear.
Yeah, hearing you loud and clear.
بسم الله الذي لا يضر مع اسمه بشيء في الأرض ولا في السماء والسميع العليم. I'd like to start with pharmacist. Is it Ademi? Adeni, thank you very much. He talks about dosage and administration of drugs. Like I said at the beginning of this thing, medical practice before modern day practice of medicine about 100 years, 1,200 years ago has been practiced. And when I was talking about pawpaw leaf, I gave a dosage. Let me give you an idea of this. I say pawpaw leaf, if you look at them, they have between 8 to 9 fingers. And you take the one on top. Usually they have 8 to 9 fingers. So that gives you an average size. Even within dosages, there are a range of dosage. I'm sure you'll agree with me in pharmacology. So, I mean, if you talk of weights, even weights in terms of what you use also have ranges. So, I say take one pawpaw leaf, put it in 1 liter of water, boil it for 20 minutes, and share it into 3. That's a dosage. So, and the administration is that, and I remember I said that by the time you get cure of what is disturbing you, stop using it. I also talk about that bottle soda, and I told people that when you're using a bottle soda, there's a point at which you stop because it also have side effects. So, because excessive use of soda, a bottle soda, can increase your blood cholesterol level. So that is that about that. Because I know that's his contribution, which makes sense because it's what we do in modern medicine. But I'd like to go back to the initial question after this one. You talk about whether we can get the slide or the books for this thing. There's a lot of books. For me to get to this small level that I am now, I've read so many books. So, unfortunately, the beauty is that as AMP records this and you can play it back, I'm sure everybody can get it. I'm sure our moderators and the guys, Brother Ajiroba and the rest, can place it on a platform where you can access it and play it back to back and to back again. Secondly, I say, how can we approach the issue of hijab? Because some people have fear. That's from my brother Sadullah. That how can we because there are a lot of quacks. Of course, there's a lot of quacks. That is why, for me, in the institute where I train, I think there are only 3 of us in Lagos. And we encourage more and more people to go there to train because I also want help. Because the pressure on the hijab is not my major work, but it's giving me some stress already. So I wish we can get good people that can be trained over a period of time. But then I would recommend that the training would be at the same institute where I train, so that you get the best of all round. Because it's not just Ijama, they will teach you how to deal with herbs and the rest, and teach you how to do spiritual healing and different kind of how to take care of courses and iron and gene craft. So that is that. That you're saying if I can do it, I'm sorry, I may not be able to do that. Then another person talk about Ijama. Yes, I can do Ijama, but I don't do Ijama for women. I've done for several people in Lagos, but I don't do for women. I'm sorry. But I have a sister in Ikorodu. Sheikh Adela, who knows the sister, also a medical doctor, also from the same school, trained from the same school that I trained, and she can do good Ijama for the lady. Someone talks about aloe vera as one of the prophetic herbs. Aloe vera is not one of the prophetic herbs, but then it doesn't mean it doesn't have medicinal value and not treat whatever you talk about malaria. Brother Balakis also talk about Abba being used for glaucoma and how. First law of test using Abba for glaucoma is that you're going to go to the hospital and confirm the level at which your glaucoma is. It's going to form the basis of which your prescription for use of for the Abba will work. So we must know the level. Your tests for glaucoma tests in the hospital will confirm the level at which it is. It's on the basis of which we know whether your dosage will be 2 or 3 times a day or how many weeks you are going to take it. So that is how the details is. So it's not something I can tell you right now until you go through that process. Typhoid and malaria. My brother also talked about typhoid and malaria. That is not the same. Yes, certainly not the same thing. But because in this country, like he said, we use typhoid as I say, it's the brother of things, because that's the understanding. The most important is that the moment I said it here, everybody understood. So this thing's about understanding it. All right, let's someone talk about seed relief. Talk about seed. That I should talk about seed relief. I guess that was the question. But seed is in Hausa they call it magaria. The other name for it is lotus. It's also called jujube in English. Usually in the northern part of the country, they use it in water dead body. And even in some Arab country, they use the leaf of cedar to wash dead body. And also, I remember in spiritual healing, Rasulullah sallallahu alaihi wasallam talk about cedar leaf, that you can crush 7 cedar leaf in between 2 stones, and you can use it to help gene, depending on the kind of gene, because they are about different kind of gene and different things that they don't like. Generally, them don't like cedar leaf, especially genes that are younger genes. A younger gene will be like 600 years old gene. Anyway, so cedar leaf can be used for that, and it can be used to expel worm. It's also used very, very rich in vitamin C. Also an antifungal. So talking about cedar leaf, that's the leaf I can talk about it. Then the curative therapy for cancer treatments. If there's prophetic help for see the beauty of prophetic medicine today is that a lot of people have used so many things to treat cancer. You can't believe, you find it very difficult to believe that as small as the leaf of the guava that I mentioned earlier on has been manipulated with some other herbs to cure cancer in various parts of the world. So, but then if you're looking for a book to do that, I'm sorry, beyond Tib Nabawi, there's a whole book about 632 pages. If you can get that and study cancer, on that Tib Nabawi has a book on Islamic medicine, 632 pages. If you can get that book and buy and study it, you see how treatment of cancer is done in prophetic medicine. Yeah, they say curative therapy. Okay, there's another question talks about medical cure for weak erection. How can we get help? Well, it depends on what causes the erection. So the person must be duly like they do in medicine. So there'll be a lot of questions. If it is physiological, is it psycho-spiritual? And has it been effective before? Has it not been effective before? At what point does it stop? Is somebody, those things need to be investigated properly before making prescription. I can't make prescription for you now. There's a gene whose job is to disrupt marriage. So that is their job, because anything that Allah loves, jinns don't love it. So when you are a friend of jinn, then you get afflicted. But when you are not a friend of jinn, how can you be an enemy of jinn? Because when you love Allah, when you love the Rasul, when you do what Allah wants, when you do what Rasul like, then the jinn will dislike you because they're not going to get joy from you. You deny them food. When you are eating, you say Bismillah, they are not happy. So the jinn in your house will be starving. So, but then, until the person is properly checked, properly go through the process of being interviewed, then we'll now be able to diagnose. It depends even what he sees when he sleeps and what he does in real life. Those are some of the things that we'll double check for us to know how to approach it, because it's not a one-way approach. But the medication for it, if it is physiological, it's very easy, very, very simple. Everybody even knows it. But then, if it's not, so if his own has gotten to that level, then we wouldn't know. Allah. So that's my response to that. Except if there's any other question, that would be all question I've been able to. If there's anything I missed, please let me know. But that's it that I've put down, inshallah.
All right. Thank you very much to our facilitator for providing apt and detailed responses to the question. And thank you very much to everyone who listened as well. On that note, I'm going to pass the virtual podium to our Vice President One to give his vote of thanks. So I'll be calling on Brother Kamoru Akinwale to give the vote of thanks.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.
On behalf of Association of Muslim Professionals, I wish to express our gratitude to our today's lecturer, Dr. Salaudeen Mohammed Bashir. May Almighty Allah reward you both in this world and the hereafter. Actually, by the way, just like one of our imams asked, that a lot of people are somehow scary to go for hijama. I can confirm that it is exactly like that. But alhamdulillah, I can also confirm that of recent days or weeks, I happen to be among those that have gone through that process. And I can confirm the difference, especially because going through my blood test, details of the sample, and after going through the process of copying and the earth, those changes I can confirm. I can as well say that if one follows the procedure of the test, because it is after that one you will be asked either to stop one thing or the other before you are allowed to do it, and thereafter one will see changes. I think it's beneficial. I can confirm that. I did my own last just about a week ago, and up to today I can see the difference. So may Almighty Allah make it easy for everyone that decides to go for it. So on a final note, as I've said, we thank Almighty Allah who has made today possible for us to listen to our brothers, and we thank him for sparing his time to be able to throw a lot of insight for us to continue asking for more. And like our publicity secretary has said, and also the XA, we are going to have the recorded version of this session as soon as possible so that discussion can continue. Let's continue to make more clarification, and where advice is necessary, then we can likely get it. So the matter is not closed as we are rounding up this particular talk. So once again, I want to thank everyone that has made this program possible, because it's one thing to have a lecturer, and it's also another thing to have people that have made themselves available, more than 50 of us. May Almighty Allah reward us adequately. So I thank everyone, and I pray Almighty Allah will continue to guide us in our various decisions. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa
Wa alaikum
barakatuh.
salam wa rahmatullahi wa barakatuh. Thank you very much, sir, for the wonderful vote of thanks and closing remarks. On that note, that brings us to the end of today's health talk. Thank you very much to everyone for listening and for participating and joining in the call. It's been a wonderful session, and a very, very big thank you once again to our Dr. Mohammed Salaudeen, for a very detailed and informative session. On that note, أنا بك بالذات أما يصفون. Assalamu alaikum alhamdulillah rabbil alamin. So I'm going to say Brother Saad would like to give us the closing dua. Brother Saadullah.
Alhamdulillah, alhamdulillah rabbil alameen. We said jazakumullahu khairan to our facilitator and to all those of us who have joined the program. May Allah make it a source of joy for us here on earth and on the day of Qiyamah. May Allah reward the facilitator and reward each of us for joining and making it a good day. May Allah continue to bless us. May Allah continue to strengthen us on His path, and may Allah teach us and give us all the wherewithal to be good Muslims and healthy Muslims. Because Rasulullah said, healthy Muslim is better than any other. May Allah continue to increase us healthy. سبحان الله سبحان الله العظيم ربنا لا تزغ قلوبنا بعد إذ هديتنا وهب لنا من لدنك رحمة إنك أنت الوهاب اللهم ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار سبحان الله لا إله إلا أنت أستغفرك وأتوب إليك سبحان ربك عما يصفون